Okay, so to disinfect my equipment, my utensils that I usually use, I'm gonna first put on my goggles, and I'm gonna continue my process with putting on my gloves. And I have paper, pen, because we need to put the name of the equipment and the date we're putting it in. Gauze, my bags, my utensils that need to be steriled, my bucket so we can soak them a little bit, my sterile bucket, and my Pro Side to continue in doing my sterilization. We don't want to have any cross-contamination with any patients. It's very important that we sterile all of our equipment. So I can sterile, you always want to wear your gloves, because some of these things, these utensils or tools that we use with our patients, sometimes they have blood, so you make sure you want to be safe on your side. So basically, you grab them, wash them with warm water, soak them with your Autoclave, wash them, every single one of them. I'm gonna make sure they're open. Like right here, I have my scissors to remove sutures, other ones. So we want to open them up, all of them, air dry them, put them down so they can be air dried. They're going to be air dried, and once they're air dried, you want to make sure that since these have sharp edges and they can rip open the bag, we need to make sure we wrap them around so they don't rip open the bag or Ziploc. You want to make sure it's open. You want to make sure that it's not tight and it gives it space. So this is a suture. It's so we're gonna put the date. Today's date is July 7th, 7/7/2020, and it's a suture removal scissors. We put it inside the bag. And it's ready, so we can put it in our autoclave. We're gonna put it in our autoclave. Make sure our autoclave have water. The water needs to be removed or changed every month, and leave it in there. This is at a high frequency. It's steam, so we need to make sure we don't just go in there and open it at any time and take out the tools. We need to make sure we let it go on, and once it's off, maybe let it cool down because it is very hot. And make sure you always want to have extra, so you don't have to be waiting on those on these ones that we are sanitizing or disinfecting. So you want to make sure you always have extra clean ones, so you don't have to be in a rush of waiting for those. And that's how I basically would sanitize or disinfect my instruments, my I'm sorry, like my scissors, my citrus scissors. So once they're done, we place them in the sterile, so like that we know that they're clean and we're able to use those.